Welcome to another 3 questions in 3 minutes with our 2022 Power Players in Healthcare. Today, I am joined by Dr. Wendy Wilcox. Dr. Wilcox is the Chief Women's Health Officer for New York City Health and Hospitals, and she is a board-certified OBGYN. Dr. Wilcox leads NYC H&H in their efforts to meet the needs and improve the care for all women. And she also co-chaired the New York State Task Force on Maternal Mortality and Disparate Racial Outcomes. And she's currently the co-chair of the Brooklyn Borough President Maternal Mortality Task Force. So Dr. Wilcox, thank you for taking time out of your very important work.
Thank you for having me.
So the United States consistently ranks among one of the worst industrialized nations for maternal mortality. And based on your experience and your expertise, why do you think that is?
I really think it's important to take a look at our history and how healthcare itself was constructed and structured. And when we look at areas with the greatest healthcare disparities, they coincide oftentimes with areas that have, of course, as you mentioned, large amounts of Black and Brown people. And we look back at policy making and how that has shaped the US healthcare system, we realize that oftentimes the highest disparities are located in areas that received the least amount of investment. And that is a very fundamental reason why we see these disparities today.
How does New York State stack up in terms of maternal mortality to the rest of the country? And what protocols have been put in place to try and keep that rate as low as possible?
Right. So I would say New York State has done a very good job in terms of trying to move the needle. Back in 2012, New York State really ranked 48th among 50 states. And we're now 28th, given the latest report.
Wow, that is really impressive and quite a testament to some of the policies and just the attention that has been paid to this really important issue. So that's great to hear. And as we've both been alluding to, demographics play a huge role in this, and Black women are, I think it's something like 4 times more likely to die from pregnancy-related causes than white women. I want to ask you, how can we address this disparity? You have this experience on these different task forces. What have you found, and what is New York able to do to try and lessen that disparity?
Really, what has been exciting about what New York has done was the involvement of many elected leaders, from our governor to, there's a lot of work in New York City, to our mayor, and even the borough presidents. I'll just give you an example. Our New York City Council and mayor just passed an enormous number of bills focused on maternal mortality and reducing that. And it spanned everything from reproductive health to enabling midwives and doulas to have more involvement in care. And the main reason behind that is to try to drive down the cesarean section rate, as well as to try to improve equity in how people in their birth experience. So how do women feel about their birth, and are they given a voice, et cetera, et cetera. And so our governor has been instrumental, and state legislator expanding postpartum care to a year after birth is going to go a very long way to improve the health of all women, but especially women of color and Black women, absolutely.
So Dr. Wilcox, can you talk a little bit about what NYC H&H is doing to address issues of maternal mortality? What is the health system itself doing?
Thank you so much for asking that question, because we are doing a lot and have been doing it for a while. We started, really focusing on clinical care and making sure that we had really tight and wholesome team responses to some of the top causes of maternal mortality. That would include a lot of work around simulation and teamwork and safety. We've expanded that work to include trainings in implicit bias for our teams, enhancing support and behavioral health for our women. So we have a program called the Maternal Home, which supports women who are at higher risk for having adverse outcomes. And our maternal home team is really instrumental in keeping contact with the patient and in ensuring that they have a warm touch throughout their pregnancy and postpartum and get what they need and get the support that they need and the referrals that they need. And lastly, I'll talk about something that's fairly novel, but we're really starting to think of 2-generational care and not just what happens during the pregnancy, but really lifelong for the child. And we have a program called 321 Impact, which is really supporting the lifelong trajectory of children by integrating care for women's health, behavioral health, and pediatrics.
That's amazing. Yeah, you guys are doing incredible work. It sounds too like there are certain kind of acute conditions that you can try to minimize risk for, but it sounds like a big part of it is preventive. And so the fact that you guys are focusing on these resources to hopefully prevent ever getting to that point is really important and really great to hear. So thank you so much, Dr. Wilcox.
Thank you so much for having me.